So we'll get started with the second half of the Chapter 8 lectures, covering the female reproductive system. We have a diagram here showing some of the anatomical structures we'll be talking about today. We'll be learning the words surrounding these anatomical structures and some of the pathologies that are involved with these anatomical structures. We're going to start with the internal reproductive organs. In the female anatomy, we consider there are internal and external organs. Slightly different than what we perceive in the male anatomy. We consider those to be external organs. So the internal reproductive organs in the female anatomy are the ovaries, fallopian tubes, which also might be called oviducts or uterine tubes, the uterus, cervix, and vagina. And these are all considered, once again, to be the internal reproductive organs. Externally, we have the labia majora. These are the outer lips of the vagina, the labia minora, the smaller inner lips of the vagina, the clitoris, and the Bartholin glands. And you see these depicted here. Of course, on the right, we see the classic anatomy. On the left, we see anatomy with the outer tissue layers removed, so you can see the sort of the musculature and some of the anatomy that's just beneath the skin surface. We'll also be talking about structures of the breast, and we won't go into great depth on this, but we will cover some of these structures. We'll review adipose tissue, which once again is fat tissue. Then, of course, the breast also has glandular tissue. There's a lobe, lactiferous duct, the nipple, and the areola. So all these are components of breast structure. And we'll start with our first combining form. As I promised at the end of the lecture on the male portion of the reproductive system, this would be the first combining form of the female reproductive system, and here it is, gyneco. And this is the combining form meaning woman or female, and you see here the sort of ancient symbol that's always represented femininity. And the specialty, and that ties directly into the last combining form I showed you. Ladies, you're probably very familiar with gynecology. It's abbreviated GYN. And this is the study of the female reproductive system. We see a patient here in what's called typically the lithotomy position. And it's, well, ladies, you're quite aware of what exams happen in this position. It's also similar to the position that females are placed in during birth, or while giving birth. I should be more specific about that. And of course, the gynecology is performed by a gynecologist, a specialist in the women's reproductive health. In other words, gynecology. So do recall that men go to urologists for urinary tract issues and for reproductive issues. Females go to a urologist for urinary tract issues and a gynecologist for reproductive issues, and also basic screenings. So taking the word gyneco for woman or female, we have gynecopathy. This is an umbrella statement that's basically talking about any disease that's unique to women. Once again, we had that same similar statement when we talked about men, and when we say unique to a gender, primarily, especially in these chapters, we're talking about reproductive tract. So we have a couple of examples here, something called endometrial cancer, or ovarian cancer, and ovarian cysts. So the first two I mentioned are malignancies, and the ovarian cyst itself is benign. And we're going to cover some of those pathologies in this lecture today. Now, we also have another specialty that's tied in with gynecology, obstetrics, and it's abbreviated OB. Obstetrics is the branch of medicine that deals with pregnancy, childbirth, and puerperium, and this is the period 4 to 6 weeks after delivery. This is a significant amount of time for both the baby and the mother. It's where bonding happens. It's also a place where potential pathologies can present for the mom. Things that we normally associate that are complications during pregnancy can actually present up to 6 weeks after birth, and in some cases longer than that. So it's a time we want to monitor everyone. We want to make sure the baby's good, mom's good, and we want to have frequent check-ins. OBGYN, you see here at the bottom. So you probably have all heard these terms before, and it ties into the sort of marriage, if you will, of obstetrics with gynecology. And so to be more specific, in obstetrics, we have an obstetrician. They are a physician specializing in the care and treatment of women during pregnancy. So not all doctors who deal with gynecology also deal with obstetrics, but many of them do. And this is where you get the phrase either GYN or OBGYN, or in some cases, it's rare, you'll see just OB. It's not as common, but those practices are out there as well. So Oh, pardon me, we went backwards. Let's go forwards. Here we go. Another combining form, actually two of them for you. In our first anatomical structure, ovario or oophouro. Either combining form means ovary. And the ovary, of course, produces gametes. It's the female sex reproductive organ in which eggs, being the ova, and the female sex hormones are produced. So essentially, that's all the further we go with that definition. You can see the location of the ovaries here, and you'll recall from the lecture over the male reproductive system that the ovaries and the testicles develop in the same place in the fetus when in the womb. And the difference, of course, is testicles will eventually descend. Ovaries should not descend. In fact, they don't descend. They're hopefully going to stay exactly where they've been placed or where they've been formed. And when we talk about ovaries, of course, we can't ignore ovulation. This is when a mature egg, known as an ovum, is released from the ovary. It's pushed down the fallopian tube. And by the way, it's helped down the fallopian tube by aid of peristaltic contractions, much like the peristaltic contractions that we explored in the GI chapter. It's pushed down, or it's moved down the fallopian tube and is available to be fertilized. Approximately every month, an egg will mature within a woman's ovaries. So this illustration you see here is not a series of eggs that are being released all at once, but it's rather the route of one egg, or one ovum, as it's released from the ovary, going into what's known as the fallopian tube. We'll learn that term a little bit later, and implants itself in the very fertile endometrium inside the uterus. And so you see that depiction here. And if you didn't understand all the terms I just described, we're going to get to them all today. So this is ovulation, and this is the implantation of an egg into the wall of the endometrium to prepare for fertilization. So this is the ovary preparing to potentially create a child. So getting back to ovario and oophouro, and I'll just share with you that oophouro is one of my favorite combining forms in all of medical terminology. Ovarian, this is using the top combining form here. This means pertaining to an ovary. I just said ovarian. Often people will say ovarian. Either pronunciation is correct. Ovariorexis is the rupture of an ovary. And if that should happen to rupture, oophouroplasty would be the procedure to repair it. So it seems an odd pairing there. If it's ovario, if it ruptures, it's oophouro if we're going to fix it. Now, that does not mean anything characteristic about these terms. As a matter of fact, you're going to find out that these terms are kind of mix and match. So between ovario and oophouro, one of the few times in terminology when we just have two combining forms that get interchanged all the time, and it's completely acceptable, and it makes it maybe easier for you because it's not so specific to a combining form. You have options here. So this is our mix and match page, is what I like to call it. You can pick whichever combining form you prefer. You could say ovarialgia, or you could say oophoralgia, and that means pain in the ovary. You could say ovariopathy or oophouropathy. In either of those, it means disease of the ovary. Once again, blanket terms, right? They're not specific. They're just generally disease states. Ovariopexy or oophouropexy is a surgical fixation of an ovary. And ovariectomy or oophouroectomy is excision of an ovary. So I'll let you decide when it comes to the exam. Either one of these combining forms in this particular context, either combining form is acceptable and will be considered a correct answer. Okay, so I may have mentioned to you before, I do speak German. I have very close family members who are German, and I lived in Germany for several years. This is a German term. In German, we would say Mittelschmerz, and in English, we say Mittelschmerz. So sounds a little bit more appropriate, I suppose, in German since it's from their language. This is a pain during ovulation. It usually occurs mid-cycle. Not every female deals with this, but the ones that do have varying degrees of it being really intrusive on their life, and others find it to be present but not a big deal. If you're curious about the word in German, Mittelschmerz would means pain in the middle. So it's basically saying abdominal pain in a very vague sort of way. But if you say it in German, they will understand what you mean. Okay, we mentioned fallopian tubes before. So those fallopian tubes that you see here depicted in the drawing, they are accepting the ovum as it's being released from the egg, and their job is to use those flagella that they have in the end, those finger-like protrusions, to pull that ovum into the fallopian tube via peristaltic contractions, move it into the uterus where it can embed into the endometrial lining and be available for fertilization. So our combining form for fallopian tube, which are sometimes called uterine tubes, is salpingo. Salpingoscopy is an instrument for viewing a fallopian tube. Salpingoscope is the instrument. Salpingoscopy is the visual examination of a fallopian tube. I caught myself because I saw the Y and I said, wait a second, that's a procedure. And I was describing a scope. So just to clarify, salpingoscope is the instrument. Salpingoscopy is the visual examination, the process or procedure. Salpingocele would be a herniation of a fallopian tube, and a salpingectomy would be excision of a fallopian tube. Sometimes there's a pathological state involved in the uterus or the ovary. It will affect the fallopian tubes as well, and they will also have to be removed or somehow surgically altered to stop, especially malignant disease processes. Meno is our combining form to describe menses or menstruation. Just for one moment, I want you to take a look at the word menstruation. I know a lot of times in English, it gets pronounced different ways. Menstruation is what I often hear, and you're welcome to use it that way. The reason I'm pointing it out to you right now is because we're learning terminology, and you may have to spell this word, and I often find that if I pronounce it correctly, I spell it correctly. So if you take a quick look at it, it's menstruation, not menstruation. It's menstruation. So just pointing that out so that you're aware of it. And on that note, menstruation is the monthly flow of blood from the uterus, otherwise known as a menstrual period, and we also call it menses. So that's a more of a, how would I say it, more socially acceptable term in a medical setting. Instead of asking how often you have a period, say when was your last menses. Menstrual means pertaining to menstruation. Menarche is the first menstrual period. Menorrhea is a normal menstrual flow. And menorrhagia is a heavy or long or prolonged menstrual periods. So we have the rhea and the ragia there. Now we're applying them directly to the female anatomy. And on that note, LMP is an important abbreviation. It means last menstrual period. It's the first day of a woman's most recent menstrual period. Often in medicine, when we do pap smears, we ask you this question. We're going to ask you the question in radiology. When was the last menstrual period? Because we need to understand in those cases, especially if we're doing something invasive like a pap smear, or we're going to be exposing you to radiation, we want to make sure there's no chance of a fetus being there. So the menstrual cycle, and this is probably more for you guys than it is for the ladies, because you are quite aware of how this works. I would think. I'm sure most of you are. Day one is when bleeding begins. That can go anywhere between for some females it's less than 5 days, and average is 5 days. For some it's more. And then there's a sort of a gap time, and that time between 11 and 15 days from day one is the peak of fertility. There's different myths and rumors about when females are fertile and when they're not. What I've always been taught is what you're seeing here on this chart, and I found it to be pretty accurate depending on who I ask. But in speaking with female friends and patients, that seems to be about the target time. So I find it to be reliable. I've had gynecologists tell me that is the fertile time. So starting on day one, that's when the bleeding begins. And on the calendar we have marked here, it's September of 2013. So day one was on the 9th day of the month. So from that point forward, you can measure the cycle as being 28 days. And once again, peak fertility between 11 and 15 days. After that fertile time, the endometrium, that fertile lining I mentioned earlier, along with the ovum, will sit dormant until we get to day 28. And when the bleeding begins, the tissue and the blood that comes out during the menses is that menstrual lining along with the ovum being discharged from the body, and body preparing to implant another egg, and the process begins over again. So 30-day cycle. Once again, that's not anything new to you females out there. For males, it might be sort of informative. Okay, that's our last slide for this section of the lecture. I have hit my 15-minute mark. I'll be back in just a moment, and we'll cover some more terms dealing with the female reproductive system.